So what do we mean by dry needling 360? Dry needling 360 is basically a lecture series which talks about dry needling overall, how it works, and how to use dry needling. Right. So how do you do it? And you go through the study material which is tailored for this session. Each session there will be a study material. People who have registered for this course are already there in the different WhatsApp groups, and I have got massive amount of registrations. Hundreds of people have come forward and registered. Thank you so much for that. So all of them will have got the link to the study material. Once this video goes uploaded after this live session, the study material I will put in the discussion or in the description of this video as well. Once you go through the study material, or if you are watching the video first, after that go through the study material, then the video, of course, if you are here, you are watching the video, then you are going to attend the quiz which is in the given link. The link will be in in the description of this video. Also, you can attempt the quiz anytime afterwards. Now if you take the quiz, you will see that the quiz is not getting very high rank if you want to rank it in Bloom's taxonomy. The reason behind that is the quiz I have designed to kind of hit the hammer on the nail so that your understanding becomes a little better. So quiz is the part of the learning process, and here's the secret: you can retake the quiz again and again and again, because once you download your certificate will show how many questions were there and how many questions you have answered correctly. So download the certificate only when you have answered 100% of the quizzes correctly. Right after you attempt the quizzes, when you submit, you will get to see how many questions you have answered correctly. So no, I hope that you will make that extra effort. If you make any mistake, just go back, retake the quiz, and take 100% of the marks, so that the information that I want to provide becomes transferred into knowledge into your mind. And then after you have taken all 6 lessons, all 6 courses, you'll get a course completion certificate. So there are 6 lectures in this series. The first of this is the introduction to dry needling, basically what I'm calling it as what the heck is dry needling. Then the next lecture tomorrow is to needle or not to needle. That is the question, which means indications, contraindications, and dangers related to dry needling, which is very important because first rule of any treatment is do no harm. And then the third day we are going to talk about the amazing myofascia, because all we want to do with the needle is to modulate the myofascia, what I call it as myofascial modulation. Then the next lecture will be the cure for the pain is in the pain, which is basically some a line which I have lifted from Rumi, which means that if you poke the patient, you give the patient a little bit of pain, but you are creating analgesia. And what is the mechanism of dry needling for analgesia, we'll have to see. On 20th, we'll talk about why and how of the needle manipulation. Once you insert the needle on the patient's body, you manipulate the needle in a certain way, and we will see how to manipulate, what are the techniques, why do you manipulate, what are the indications for manipulation, so the clinical reasoning behind it. And then the last day we'll talk about standardizing the delivery of dry needling. So this is in brief how the course will unfold. After each lecture you can go back and take your MCQ, take your quiz, download your certificate. After the last day we'll probably do a sum up session, and we'll give a consolidated course completion quiz, which will be a little more tough. And then once you attempt that course completion, you will get the certificate of course completion. Now coming back to what the heck is dry needling. What comes to your mind, or when you first heard of dry needling? Most of us, for example, in my UG or PG, I did not know much about dry needling. I completed my PG in 2008, and that time in the Indian scene, dry needling was unheard of. So when for the first time I heard about dry needling, the first thing that came to my mind is acupuncture, because what I felt was dry needling is like acupuncture. And I'm sure for most of you, if you knew acupuncture beforehand, dry needling may have come as something close to acupuncture or physiotherapists performing acupuncture. And because acupuncture is having Chinese origin, we think that dry needling has a descends from uh, China. And although I am not racist, I cannot help myself crack a joke that because China has this uh, dubious honor of the mass producer of the world, especially our electronics. The thing that come from China are very cheap, and they kind of if they last long. On the other hand, sometimes they don't work at all. So the joke goes like, love is Chinese because if it lasts for a lifetime. But if it doesn't, 15th February itself, game over. So, jokes apart, I used to think that dry needling is a Chinese form of therapy. And then we cannot comprehend that how a simple needle on the skin does not contain any medicine through this. We do not give any medicine through this, can produce any benefit at all. So we think that, at least I used to think that dry needling must be something like a placebo. And then, because we do not understand, you may feel like dry needling is an unscientific form of therapy. But still, we feel a little curious because uh, when you hear, after all your UG and PG for years, when you hear there is a form of therapy called dry needling, which has not been taught in your school syllabus, you feel, what does that therapist have which I do not have? So we do feel a little curious, and nowadays what happens is the patient looks up in the directory, and patient asks that, okay, this is the physiotherapy clinic. Do you have dry needling? My friend has got wonderful result in dry needling, and I would like to uh, get treated with dry needling. Now, if I don't know dry needling, I will say, no, I don't have dry needling, but I have other forms of manual therapy. The patient will keep the phone. Then he will look at the directory, call up another therapist, and ask, do you have dry needling? So it's a good skill to have. It's a must skill to have nowadays if you're practicing outpatient based musculoskeletal therapy. So we feel a little curious, what is dry needling? So if dry needling is not acupuncture, neither it is Chinese, nor unscientific, nor it is placebo, what the heck is dry needling? So let us first see if it is acupuncture or not. The worldwide authority now for trigger point dry needling is Jan Domahol, and you can find him saying in his book, from a physiotherapy perspective, from a physical therapy perspective, trigger point dry needling has no similarity with traditional acupuncture other than the tool. So when you talk about the tool, we are talking about the acupuncture needle, the needles that we use for dry needling. Now the needles actually has a history. When you see the history of dry needling, we'll just talk a little bit about history of dry needling now afterwards. You will see that initially dry needling had been started in the early 19th century using injection needle. And if you remember the old style injection needles, which we used to get, although I'm pretty old now, my hairstyle says that, we used to get is those the glass injection needle with thick reusable glass injection syringe with thick reusable needles. So those were the kind of needle that had been used in the initial days of dry needling. Very, very late, in 1979, the Czechoslovakian osteopath called as named Karel Levitt started to use the acupuncture needle for dry needling. And he found that acupuncture needle has several advantages. So acupuncture is not the origin of dry needling per se. How about China? What is the connection with China? If you say early proponent of dry needling, they include Kellgren, who is British, Chan Gun from China, from Canada. We had talked about Karel Levitt, who was from Czechoslovakia. We the trigger point dry needling Bible is written by the duo of Janet Travel and Simon, and they are from USA. So and if you talk about Leon Chaitau, he is a Greek person. He has significantly contributed in the field of dry needling. So they are all people from the Western world. Now again, an interesting anecdote. If you see this person, he was a reporter of New York Times, and he had gone in 1971 in China, Beijing. That time it was called as Peking, and he had developed appendicitis. He had gone just a little bit before first visit of any US president into China. That was in 1972, and he went there to report something, and he got appendicitis, and he was treated with acupuncture. And that time in 1971 was the time when he introduced the concept of acupuncture in the Western world, in USA and overall Western world. And that time onwards, acupuncture became popular, and the popularity that is it enjoys in today's world is because of or can be traced back to James Reston's articles in 1971. Now, when do you how do you say it is scientific? Any treatment, if you have to say it is scientific, there has to be proper research. So if you see dry needling, again, dry needling is an umbrella. It's just a tool, it's like a pen. You can write letters, you can write poetry, or you can just scratch and produce gibberish, no meaning at all. So a large amount of evidence exists for dry needling. Systematic reviews, including Cochrane reviews, have shown the usefulness of dry needling. However, because dry needling is such a vast area of manual therapy, there is always scope for newer research, and there is a need for high quality research, which is not a bad thing. Especially if you're a student, then this is the proverbial gold mine. If you have interest in the myofascial or musculoskeletal, neuromusculoskeletal structures and their treatment, dry needling is the area to be in today's world. Placebo. Now the problem with placebo is it's very difficult to negate placebo. So if you have to be objective, you'll have to say that if I have fever and I have belief in one brand of paracetamol, acetaminophen, Tylenol, whatever you say, then my fever tends to get better in that brand of paracetamol. So it's for humans, no, the expectations from the treatment is so much intertwined with the actual treatment. It's very difficult to separate out placebo. So how do you differentiate or remove placebo? One of the answers is animal model. So if you can, because animals do not have that kind of expectation, no? So what you can do is you can create pathology in the animal's body, you can needle that pathology, and you can easily sacrifice that lab rat and then check with that particular tissue under the microscope and see if there is any observable, verifiable, reproducible result. If you get that, then you can say that it has a lot of, or it is physiology based and it is not placebo. Others are placebo controlled trial in human models. So there is a sea of evidence showing objective, measurable changes which can rule out placebo only theories. So if it is not unscientific, if it is not acupuncture, not Chinese, what the heck is dry needling? Dry needling is a procedure where filiform, that is solid needles, are tapped through the skin to the target tissue to bring about a therapeutic effect. Why do you call it dry? Because no medicine is delivered. On the other hand, The other form of needling that we go through predominantly, I hope many of you have taken a needle in the last previous few weeks as the first, or if you're lucky then second shot of vaccine. That would be a wet needle, because in the injection, in the needle, you're passing through uh, a liquid. So dry needle, there is no liquid passed, so it is called as dry. Now if you see the history of dry needle, because we must know where we are coming from to understand where we are going. If you see a brief history of needling, then in the year 1828, English physician Churchill tried to needle the points of maximum tenderness in a condition called as rheumatalgia, what we know as fibromyalgia, and he was so impressed with the results that he has published a book with his findings. The next documented evidence comes in 1912 from Sir William Osler, who was a professor of medicine at Oxford, who described dry needling of lumbago, which is musculogenic low back pain. He also had published this in his book, and he has inserted 4 inches, that is 100 millimeter length of needle uh, in the lumbar muscles at the seat of the pain. So why these years are important is because the numbers are, or the years are much before the 1971 article, which means that there were independent effort of needling before the medical community came to know about the procedures of acupuncture. In 1938, Kellgren injected local anesthetic directly into the trigger point and deactivated them. In 1940, Stindler used the term trigger point for the first time. In 1941, Braven Sigmund published that pain can be relieved by simple needling without injection, and they have found that compared with needling with injection, whether it is saline water or local anesthetic, they found that the effects of needle without injections are far better, and they describe their finding as startling result. Now it was starting to dawn upon the medical community that maybe not the effect of local anesthetic, neither the chemical effect of normal saline, maybe the mechanical effects of the needle on the patient's muscles are producing the beneficial effects or the results. The term dry needling, again there is a contest, multiple people say that they have used the dry needling term for the first time, but the document that I got says that Paulette used the term dry needling in 1947 for the first time, and the description of the needling method was also in detail in Paulette's article. In 1952, Janet Travel and Rinsler described the trigger point and myofascial pain in details. Although the term trigger point was used by Steinler, the classic trigger point that we understand was defined by Janet Travel and Rinsler in this article. And they have mentioned dry needling as an effective means of treatment of trigger point. Janet Travel was a very colorful character. She was the personal physician of John F. Kennedy, and Kennedy was actually needled by Janet Travel for his conditions. Then in 1955, Sola and Quittert injected saline water in trigger point, and they found that normal saline was better than local anesthetic. Again, not the chemical effect of local anesthetic, but the mechanical effect of the needle, because normal saline is, which is already there in the body, are of same therapeutic value, because there are problem with the local anesthetic. Local anesthetic, if you insert in the body, in the trigger point, yes, you will get a significant amount of analgesia, but the problem is if it is around the nerve, there will be temporary paralysis, and because it is anesthetic, the area where you have injected the needle will also be say anesthetic. So imagine I'm having tennis elbow because of a triceps say trigger point. You inject local anesthetic in my triceps, my tennis elbow pain is gone, but I have ended up with a wrist drop and an anesthetic posterior area of the arm. Not the greatest of the medical outcome scenario. So then again, this 1971 is when James Reston wrote the article on acupuncture. In 1979, as I was discussing, Karel Levitt of Czechoslovakia had used the acupuncture needle, and then onwards, the physiotherapist community or dry needling community had slowly embraced the acupuncture needle and discarded the injection needle because it reduces the risk of hematoma, it reduces the risk of bruising, it reduces the risk of bleeding, because as you have seen, most of the needles are very thin. So the injection, the cannula, IV cannula, can be as thick as say up to almost 3 millimeter or 2.5 millimeter. On the other hand, these needles are having diameter of 0.25 millimeter, sometimes 0.15 millimeter. So 10% or 1/10 of the diameter. Uh, Again, there were other studies related to saline water and local anesthetics. And then in 1984, in the state of Maryland in USA, the physiotherapists were legally allowed to needle the patient. So that had been the journey of dry needling from the beginning 1828 to 1984. Now, because dry needling has originated in different schools, different physiological geographical area, dry needling has developed multiple schools. And what are the schools? Uh, there are multiple models. The most researched model is trigger point model. Trigger point model says that myofascial pain originates from myofascial trigger point. If you deactivate the trigger point, uh, then the myofascial pain will go away. The functions of the muscles will be better. The function of the body as a whole will be better. Trigger point was the the origin or epicenter of development of dry needling, and that is why it enjoys maximum amount of research. It enjoys maximum amount of probing also. So dry needling, when you say dry needling, primarily we mean trigger point dry needling. But then there are other reasons to insert needle into the body as well. The other models are, for example, radiculopathy model of Chan Gun. Chan Gun, a Canadian citizen, a physician, said that if there is a tightness of the paraspinal, and primarily he talked about multifidus, which is a transversus spinalis muscle, so it originates from a transverse process, inserts into the spinous process 2 to 4 segments above, and then if this muscle contracts or any other of the paraspinal muscles contract, according to Chan Gun's hypothesis, this contraction reduces the space between two vertebrae, and that reduction in the space between two vertebrae compresses the nerve root, and because of the compression of the nerve root, there is manifestations in the patient's body, in the effector organ, let us say. So imagine if someone is having a gastrocnemius trigger point, probably Chan Gun will also ask you, or also propagate that needling of the L5S1 place where there is the nerve root comes from, and the multifidus or paraspinals needling there. So that is the radiculopathy model. In zest, of course, there are other manifestations or other clinical implications of it. Then superficial dry needling. Peter Baldry, one of the most famous physicians who dabbled into dry needling. Peter Baldry has a fantastic book on dry needling. Now, he has a story to tell. He was into pain management. He was a pioneer in pain management, and he used to use dry needling for pain management, being a physician. One day, he was trying to needle a patient's scalenus muscle, and that scalenus muscle, because it is so close to the lung, he just pierced the skin, and then he thought better of it, because again, safety first. He did not insert the needle into the scalenus, he just pulled it out. However, that process itself had given the patient enough analgesia. So Being the analytical mastermind our Peter Baldry was, Peter Baldry had probed this further. In other patients also, he started to needle the patient only skin deep, never going into the muscle, never going into the trigger point. And he found that in all these cases, the patients are getting significant amount of analgesia even by piercing the skin. And that helped him to hypothesize that there is a thing which can be practiced safely, which is called as SDN, superficial dry needling, where you don't have to go into the trigger point. You just have to locate the trigger point accurately, find the point of maximum tenderness, insert the needle 5 to 10 millimeter, keep it for some time, pull it out, and the patient can get analgesia. You may feel that how can this happen? Inside the body there is no wireless technology. No, there has to be that physical. We are talking about mechanical effect, we are talking about effects of needle or mechanical effect, and not the chemical effect of the local anesthetics or say even normal saline. Then if you are unable to reach the point of origin of pain, how can you justify that the trigger point can be deactivated or the pain can be taken away? The reason we will discuss when we talk about pain management via dry needling, which is one of the forthcoming lecture, but very loosely, the benefits of dry needling or a lot of effects of dry needling are happening because of stimulation of the A delta nerve fibers. And on the surface of the body, we have maximum concentration of the nerve fibers. And that is why superficial dry needling, at least for analgesia creation purposes, are so successful. There are, of course, other models of uh, dry needling. They're called as spinal segment sensitization and neural acupuncture. And then there is model of Yuntauma, and then there is model of Pablo Herrero, DNHS. So all these are multiple other models of dry needling. Some of them are not extensively researched, some of them are based upon statistics, but these are the basic models: superficial dry needling, trigger point dry needling, and say radiculopathy model mm, are the basic foundations of evidence-based dry needling. And for the others, for example, spinal segmental sensitization, as I have written here, whenever dry needling also involves injections or introduction of the pharmacological agent, as a physiotherapist, physical therapist, at least in my country, I am not allowed. So I usually refrain from that. Then, before I go into the description of the needle, there are certain newer, or I would say more precise uh, versions of dry needling. For example, in many countries, dry needling is being done in conjunction with musculoskeletal ultrasound. It makes your needling so very accurate. What you have to do is you have to use an ultrasound probe, visualize the structure you want to needle, for example, a trigger point or a specific muscle or scar tissue, insert the needle, like you can do it under direct visualization. Unfortunately, in my country, the ultrasonography scene is heavily regulated by law. So unless you are a radiologist, not even if you are a physician, you cannot own uh, a musculoskeletal ultrasound machine that has to do with fetal gender detection and our social discrimination, social taboo, and the effects of repercussions of that in the society as a large. So that we cannot use. But then there are other exciting works that are being done. For example, Pablo Herrera of Italy is working extensively on spasticity, which is called as DNHS, dry needling for hypertonicity and spasticity. And if his work is to be believed, he's creating fantastic amount of results. And in our clinical setups, in our academic setups, we have done enough treatment of spasticity with needle to vouch for yes, this works. But again, more and more and more research are are needed to make it en masse, like trigger point dry needling. And again, there is another technique of dry needling which will be called as percutaneous electrical nerve stimulation, which use the TENS along with needle. So now coming back to needle, there are various sizes of needle. I have chosen the biggest one that was lying in my home today. So needles can be as short as 1.5. 12.5 millimeter is about half inch. 13 millimeter, 12.5 millimeter, or can be as long as 100 millimeter, or even 125 millimeter. There is actually no limit of how big the needle will be. However, for the human body, for the average person that turns up in my clinic, I would say I have gone as large as 75 millimeter, not more than that. I don't know if a sumo wrestler walks up to my clinic, what I'll have to do. Then I may have to find a different longer needle. The choice of needle, now many of the rookie physiotherapists or first time needlers, they tend to ask that what should be the length of the needle for this condition. It will be dependent upon the depth of the target tissue and specific techniques. We'll discuss this even further in successive time. So what we use is a disposable filiform acupuncture needle with guide tube. I'll explain this. Look at this. This is like this, where you have a packet of needle, in which the individual needles are separately packed inside the tube. They are sterile and they're packed separately. Why I am emphasizing on the point of separately again and again and again is because there is also a type of needle available where you get 10 needles and one tube. So if you see the tubes are, if you remove the tube, so you get this kind of, it is best to get this kind of needles where you get individual needles with individual tubes. These tubes can be called as guide tubes. So what you do is you press the guide tube on the patient's body in your target zone, then you tap the needle through the skin to the target tissue. Now the guide tubes are held together with the needle, or needles are held together by the blue thing which is called as lock. Now this lock holds the needle, and that is why the needle does not fall. So if I can show you, this is out anyway. Just give me a minute to adjust the visuals. I hope you can see this. Yeah, so this is the guide tube. This is the needle inside, and the lock is here. The blue thing, the blue thing here is called as the lock, or you can call it anything else. But the purpose of that is to hold the needle in place with the tube. Now, if I remember the blue thing, what will happen is the needle will drop. As you can see, the needle has dropped over my keyboard. Right. So now if you see the needle, I'm not sure if you can see it, the small thin thing. No. Right. So if you can see this here, I'll try to bring it as close to the camera as possible. You can see this part is a little thick, which has a fine coil of wire. Now this is called as handle. This part is called as handle. This is the shaft of the needle which I'm touching right now, but when I'm going to insert this on the patient, I will not allow myself to touch this part because this part goes to the patient's body. And then the tip of the needle is called as the tip of the needle, the sharpest part. As you can see, the needle is very thin, and it is almost like a little thick, almost even thinner than a guitar string. The diameter is about 0.25 millimeter, and this is the guide tube. Another advantage or another use of the guide tube would be you can actually measure the length of the needle, and the length of the guide tube is almost same. The guide tube is just a tad bit longer than the needle. So actually, if the needle is say uh, this much inside the patient's body, what you can do is you can keep the guide tube next to it, and you can understand how far the needle is inside the patient's body. You can just take a measurement of how far the needle, because their distance is almost their length is almost similar, right? Let me minimize myself again. Right. So based upon the depth of the target tissue, you will use this lengths. If you are doing a lateral epicondylitis periosteal packing, probably you'll use the smallest of the needle here. On the other hand, if you are using say if you are needling ECRB or one of the forearm extensors for tennis elbow, you are going to use this one, this 25 millimeter needle. I would use this needle for someone who has an issue with this is a 40 millimeter needle who has something with say supraspinatus, mesomorphic person, or deltoid needle. On the other hand, if I have to needle the gluteus medius from via the gluteus maximus for a mesomorphic person, I'll probably use the large one here, which is about say 50 millimeter here, right? So that is how you are going to choose the needles. Then so how the needle is performed with careful precision, the structure to be needled is chosen. Then using your clean field technique, you'll have to use a sterilized disposable needle, and they're pierced through the skin to the target tissue. Now the choice of needle, how long the needle will be depending upon the depth of the target tissue. So imagine these two people, you can say Laurel and Hardy. uh, if you are fan of Bollywood, you'll probably get this movie. Now suppose I am needling the gluteus medius of this say shorter gentleman. I would probably use a 40 millimeter needle, that would be good enough. On the other hand, this WWE wrestler Great Khali, for to reach his medius or piriformis, I may have to use that 60 millimeter needle, or even a 75 if his Gmax is really bulky. But then the size of the needle will be same for both of them for lateral epicondyle. So it will depend upon the type of target tissue, the depth of the target tissue, and etc. etc. You can also now when I say target tissue, let me define what is target tissue. A target tissue is whatever structure you want to reach with your needle. It can be muscle, it can be so most often the target tissue is trigger point. It can be scar tissue. You can mobilize the scar, or you can realign the collagens of the scar fantastically with needling. It can be free nerve ending when your aim is to just reduce pain. When you're trying to produce healing, sometimes you do that lateral epicondyle, as I was saying, the junction between the say bone and the periosteum. You are doing something called as periosteal packing, or it can be needling for many other structures. Now what you use is called as a clean field technique. What do you mean by clean field technique? It's different from sterile field, because clean field is you don't have any visible dirt. You clean the area, you wash the area completely. If you're using glove, you are going to use a clean glove. If you purchase glove, in bulk, you can see in the box of the glove they will write non-sterile glove. It does not mean it is a dirty glove. It just means that it is not completely sterile. What is complete sterilization? Complete sterilization is absence of any microorganisms, which is very difficult to obtain, which is very useful when you're treating, when you're performing a surgery, when you're needling someone who is immunocompromised, or whom you are treating. Say a surgeon is treating someone who is dressing someone who is immunocompromised. But for our purposes, because dry needling has minimal or no bleeding, so you don't need a sterile field. Then the needles are kept inserted for a span of 30 seconds to few minutes. Now, why 30 seconds? Why few minutes? Is also dependent a lot on how the body responds to needle. And then you can withdraw the needle, and then you have to dispose the needle properly. So wind up part is very important, because most often we get patients who, like, we needle ourselves. So the moment the needle is out of the patient's body, it should directly go into your sharps bin. If you keep any place in between, then if that is your practice, sooner or later you are going to get needle stick injury. So disposing is also very important, and people who are in India now, in certain states, if you are needling, then probably sometimes authorities come and they ask what is your disposal system. So that is how you complete the needling. Once the needle is inserted, you may go into do some specific other techniques as well. And the techniques can be are termed as deep dry needling, when the needle is pierced deep into the muscle or target tissue. It can be also called as superficial dry needling, which we have talked about, Peter Wildry's brainchild. You can manipulate the needle. We'll do a separate session one day on needle manipulation. You can do something called as percutaneous electrical nerve stimulation, where you insert the needle, you attach the needle with the electrodes, and then with that you with tens like current to promote more analgesia. The day we are talking about analgesia, we are going to talk about the mechanism of PENS, how is it working. And then the procedure obviously needs to involve assessment, and this is my humble creation, a dry needling assessment form. I don't take any credit for this, because this is something you can say plagiarized from Mackenzie's assessment form. I liked the way Mackenzie had streamlined the way low back pain or later cervical spine assessment, and I have tried to replicate that in dry needling, because when I was treating my patients, me being so forgetful, my students and my patients understand and know, I invariably used to forget some or the other factors to incorporate while needling. So this form has multiple areas of concern related to contraindication, related to consent, related to precautions and all this. And you can also clearly record with codes how what you have done to the patient, so that, like Mackenzie, if one patient is being treated by me today and you tomorrow, the carryover is seamless, and both the therapist and the patient and the third therapist or the second therapist are in the same page. So we will discuss this in the last day in detail, and I will give you a PDF of this dry needling assessment form. Then, before you poke the needle to the patient's body, you definitely have to take enough precautions. Like this gentleman, before proposing this girl, he has taken enough precautions. Try to streamline the precautions to remind myself of the precautions, and the important factors related to this is kind of clubbed into this acronym called SPIDER. Is for surface anatomy, P is for position of the patient, I is for incidence angle, D is for the depth of the needle, depth of the target tissue, E is to educate the patient, and R is to record. And I recommend you record the session using the dry needling assessment form. And finally, when we learn a new technique, what tends to happen, we kind of become so over enthusiastic. We try to treat everything with that technique. For example, this is too much, right? I'll give you an example. Coming out of my grad school, right after my BPT, I was very confident with electrotherapy, and in my clinic I had a TENS, I had an ultrasound and electrical stimulation. So any patient comes, we used to do ini mini mini mo, and we used to put either ultrasound or TENS and one hot and cold modality. So Tennis elbow ultrasound, probably justified, but then the patient comes with headache or the patient comes with angina. uh, I would have probably, in a joking way, I would have tried to treat the patient with ultrasound. Ultrasound, I still believe, is a wonderful modality, but when it is indicated. Similarly, you treat patients with dry needling only with specific indications. Do not try to be the the Rambo and shoot down anything and everything in the body using the needle. Now, what I mean to say with this picture is dry needling is just another tool in your kitty. Dry needling is just uh, another gun in your arsenal. But every gun or every specific uh, say uh, every specific arm weapon has its own purpose. For example, in the right corner here you have a shaving blade and you have a sword which also has a blade. Purposes are completely different. You cannot do your grooming activity with a sword, at least not as good as you can do with a gillette. And then when you are into hand to hand combat, the sword will definitely has an advantage compared to the shaving blade. So dry needling has its own purpose and indication, and when used purposefully, dry needling is a wonderful form of therapy. The biggest advantage of dry needling is what your like dry needling is right, just another tool. So dry needling gives you reach where your hand cannot normally reach. It's very difficult to go into the multifidus or even something that we modulate very easily, say piriformis muscle. It's very difficult to feel the muscle or go into that specific structure and go into that pointed structure, point of pain with dry needling. But then dry needling has other disadvantages also. For example, dry needling has certain side effects which are different from our normal manual therapy side effect. Dry needling, when you have a diffused area of pain, again coming back to ultrasound example, if you follow practical dosage of ultrasound, you will have to apply ultrasound in those specific tender points. Now, if your patient has a whole back tenderness, you will have to keep on giving 6 minutes of ultrasound in each tender point, which will take hours. Similarly, if you identify in my trapezia, say bilateral trapezius, 10 points of maximum tenderness, then it is a poor choice or poor judgment on the part of the physiotherapist to insert needle in all those 10 points. So probably you are looking at something more generic or something that can affect the muscles overall in the beginning. Take away the maximum tender points or which are less tender, and then probably apply dry needle for the stubborn points which are not going with other forms of therapy. What I also mean to say is dry needling is not a standalone form of therapy. Dry needling, or for that matter any form of electrotherapy or manual therapy, has to be supplemented, or the word supplemented also does not come across correctly, because dry needling is a supplemental therapy or manual therapy is a supplemental therapy, has to be uh, backed up by exercise. The whole world, if you see the proof, it is going for functional exercise, functional movement, functional activity, functional training. So then what is the purpose of dry needling? Because if you see the studies, they will say in long term dry needling, the patients who have received dry needling did not fare any different than the patient who has not received dry needling or who have only done functional exercise. The the advantage and the real benefit of applying dry needling to the patient is the dry needling gives you immediate benefit, immediate result. So if your manual therapy or exercises had been like a staircase, slow but steady, dry needling is the elevator. So what you have achieved, the amount of analgesia you must have achieved with 3 sessions of say other form of therapy, dry needling can give you in 1 session, and that is the real advantage of dry needling. The other advantage is the reach. As I said, you may not be able to reach, and precision is the benefit of dry needling. Now, having said that, I'm a big fan of this gentleman, so much so that I copy his hairstyle. His Leon Chaitov, Greek osteopath, uh, writer of so many eye-opening manual therapy books. He says that trigger point is like a fire alarm, and this I'm paraphrasing, but you can get in his own website, in his blog, that the benefits of the trigger point is they're like fire alarm. If as a physiotherapist or a body worker, I am just treating the trigger point, I am scratching the surface or poking the surface with a needle. Trigger point is there for a reason. If trigger point is there, that means it is a kind of an adjustment. So we must find why the body is making adjustment, and we must treat the patient's root cause. Otherwise, and you must have experienced this if you are a clinical therapist, that today you have reduced muscle spasm, today you have taken away the patient's pain, you have removed that proverbial trigger point and improved range of motion. Next day when the patient comes back with similar or spasm in a altogether different muscle in the same joint or in another part of the body in the kinetic chain. That is because the root cause has not been addressed. So, as I said, dry needling is never a standalone form of therapy. Dry needling always needs to be backed up by by real exercise where the patient takes onus. You are the coach, and the patient is the performer. But then dry needling's advantages: you are putting the patient in a physical and mental state where the patient's body listens to him. The patient is able to perform because, as you know, if there is a hyperactive upper trapezius trigger points are present, every time the patient lifts the hand, before the patient gets to 60 degree, the trapezius, upper trapezius should not be firing, it will keep on firing. So with the needle, you can take away the hyperactivity, you can give the function back to the patient, and then using that you can treat the patient, and you can give the patient comfort, improvement, analgesia, and return to function. To sum up, with proper judgment and precision, dry needling is a powerful tool for the physiotherapist. Quick and cost-efficient treatment, which when indicated produces immediate result. However, the risks are real, and we'll discuss the risks tomorrow. The need for training and safety precautions, that is why, cannot be overemphasized. And finally, dry needling is not just about the needle through the skin. What is more important is the hands behind the needle, the manual skills, and the head behind the hands. To paraphrase or to copy Maitland, dry needling is not like a game of golf where your manual skills are so important. Dry needling is more like a game of chess where your mental skills are much more important. Now, Maitland said this uh, for manual therapy, especially mobilization. Dry needling has both. Dry needling is like playing a music, where your manual skills are as important as your mental skills. And when your head and hand work in synchrony, you create fantastic result when indicated with needles. That's all I wanted to discuss. Thank you so much. Thank you for being such patient audience. Now let me go to the chat box and find if there is any question. Dr. Nikhil asks, dry needling, can it be used in diabetic neuropathy? Great. Yes, dry needling can be used in diabetic neuropathy. We'll talk about this tomorrow when we talk about dangers, indications, and contraindications. But very briefly, there are studies with diabetic neuropathy and dry needling where people have got ethical clearance and they have treated patients with dry needling. Yes, Anindo. Anindo says upper trap is tender because of middle trap and lower trap inactivity. Yes, I cannot agree more. There is imbalance of the muscles, scapular dyskinesia, kinetic chain dysfunction, and all this. Harsh Narwal, I have people here who are around the globe I have anything nothing against Hindi, but there are people who don't understand Hindi, and our medium instruction has been English. So I hope you will follow. Uh, Dry needling used in diabetic neuropathy. Yes, we have discussed about that. Uh, Let me just scroll up and see if there is uh, any more questions or discussions. Oh, someone is asking about, can we use it in plantar fasciitis? Yes, we can use it in plantar fasciitis. Prem, I remember you from my Chennai visit. Uh, we can use dry needling in plantar fasciitis, multiple structures we can use. Uh, okay, some people are joking. I hope that you are enjoying the session as much as you are enjoying your friends being here online. Lumbar region, which needle we use? Again, if you are needling, uh, okay, so Prialgen, let me be realistic and say, if I get, say, for myself, if you use lumbar region, if you want to reach multifidus, I would say, for me being, say, 5 feet around 6 inches, and 60 to 62 kg, uh, you can reach my multifidus or leocostalis or longissimus using a 50 to 60 millimeter needle. If you want to reach my say uh, quadratus lumborum, you'll have to use a slightly longer needle. But suppose again you're going to that wrestler Great Khali, or now Shanky Singh has also come in WWE. So those kind of people who are 7 feet long, 7 feet tall, you have to use probably their quadratus lumborum. You may need to reach with a 100 millimeter needle. Uh, then what more? What are the questions? How to needle scar tissue and what type of scars are supposed to be needled? Smarika, hi Smarika. Smarika has been my student, I think, since 2012. Uh, Smarika, we'll discuss this and when we talk about needle manipulation. Not used for pregnant women. We'll talk about this when we talk about contraindications, absolute or general contraindication, or absolute or local contraindications tomorrow, uh, because we have we have kept that segment which is very important, when to needle and especially when not to needle. How long the class will go on? I guess I'll finish it. Sorry, I am stretching it a little more because initially there was a technical glitch. So if there is any more question, all of you I hope are there in the WhatsApp group. uh, if not, then in the description of the video I'll put my WhatsApp number. Please ping me and I'll put you in the WhatsApp group. We will continue the discussions there. Okay, thank you very much, and I apologize for the delay in the initial phase of the program. Thank you so much. See you tomorrow. Right after this, I will post again in the WhatsApp group the quiz, so that you can take the quiz and download your certificate. Thank you so much. Have a nice day.